I played basketball and football and lacrosse in high school and college, and then I went into coaching. My first job was a high school job in Rochester, New York, and I never really had any injuries at all while I played, including football. But when I was coaching in high school, we were playing in a press radio charity game, and somebody from the press that didn't know how to play basketball just lost control of his body and ran over my knee, and I tore the lateral, collateral, and anterior cruciate ligament. And it was repaired, and I actually coached the semifinals of the state tournament in a wheelchair. Say probably the last 2 or 3 years, especially that left knee that had that surgery, was becoming more and more of a pain, especially after I lifted weights or after I played golf and walked a lot. And so when I had an MRI on it, it was pretty much bone on bone. And I was probably, Dr. Williams had probably said that I was maybe 4 or 5 years away from having a total knee replacement in my left knee. So when he suggested that I do the stem cell, and we did an MRI before and saw how significant the damage was, and how I actually had areas on my knee where I had no cartilage. And we stem celled my knee, and the very next day I had relief. Very next day. I had it done on a Thursday. Friday I was able to do anything I wanted without any pain. On Monday I started lifting again, and I hadn't lifted for probably about 6 months. And now I'm probably I'm probably about 3 or 4 months down the road, and I have no pain. I'm a very, very strong believer in the stem cell. And the thing about it for me is it's not like, oh, Bob Hubbard's just saying that his knee's better. It's definitive. When we take an MRI before and we've taken an MRI six weeks later, it doesn't lie. It's not like saying, well, I took this drug and I feel better. It's not have that placebo effect. This is cut and dry. This is not up to interpretation. And that's what's very refreshing about this, is that it's the definitive results. You can actually see the regrowth in the cartilage. And like I said, I think it will continue to do that. And when it does that, then I think it's going to save the joint itself. And like I said, I'll be able to have very good quality of life until I'm done.